present, all ready to go for this afternoon. So you probably maybe caught a sneak peek of what's to come. It's like a little teaser. So we've got some great presentations coming up. So you just have to bear with me for the next 5 minutes while I just show some of the mahi we've been doing excuse me, in the digital health space. I'll just share my screen and then I'm going to hand it over to Megan at Inspiring Communities. So as you all know, we have a portfolio on digital health and telehealth. So as part of that, we've been working since the start of 2021 about really getting some momentum in the telehealth space. So as part of that mahi, we've been working sector-wide with other people who lead out telehealth in the sector, also working with people in our secondary care and community providers in this space around how do we get telehealth really going and getting some momentum, and also really upskilling our clinicians and providers in this space to be able to prepare for and conduct a successful and culturally appropriate telehealth appointment. Particularly in this environment with COVID, telehealth has really come to the forefront in providing patient care for both patients and whānau. So there is some pros and there is some cons, but really at this stage it's about keeping our whānau safe, and part of that is providing telehealth. But we really want our consumers to have a really good experience in this space. So what we identified is how do we upscale our clinicians, and in thinking about telehealth, yes, they've been providing obviously consults and that's their background, but you know, telehealth is slightly different. You know, the engagement space is really hard to get that whakawhanaungatanga when you've got a screen in between each other, but really, you know, this is where our healthcare is heading in the next few years. So we've been working at Healthcare Home Collaborative alongside New Zealand Telehealth, working with a group called Inspire Group, which is an adult learning specialist and in developing online modules. So this is one that we've started. This is our first module of a suite of 4, and it's about to go live. So we're really proud of the work that's been put into this. We've had some co-design sessions in this space, and we're really trying to step through what is telehealth and how to conduct it. So these online modules for our clinicians and providers will sit in the Ministry of Health online learning platform that they have. So in this space, there's things like COVID online modules as well as end-of-life care. So the telehealth module will sit alongside those. So really stepping through, it's quite interactive. This first module is just a basic introduction. It shouldn't take anything more than 5 minutes, and it's stepping through the basics. So what we want to do is then, once clinicians complete these modules, they'll be allocated CPD points as well. So really, you know, there's quizzes, it's interactive, there's questions, there's research to read. If there's also resources as part of that, so if people want to learn more or how to find out how to start a telehealth consult in terms of technology, patient consent, all the medico-legal requirements, this is where they can find all the resources. And you know, they sit on our Healthcare Home website, but it's available as part of this module as well. We've really tried to, you know, have a patient lens and perspective on this as well as provider. So I'm just showing it to showcase. We've even got a story here. Bill, he's from Nelson Marlborough area, and it's an oncology appointment. So what I should say is these are sector agnostic modules. So as I mentioned, for primary, secondary, aged care providers, community providers, Māori and Pacific health providers, if they want to go in and do these modules, they're more than welcome. So there's a few more slides in here. So we've got the, you know, the college statement around telehealth, which was updated probably 18 months ago as telehealth really started to take off, as well as the Medical Council support statement on telehealth. So here we've got who's using it and some actual case studies on what's working well in the sector. So how people are using it, whether it's dietitians, physiotherapy, around developing rehabilitation plans, NGOs, so hear about Plunkett and lactation consultants, and then aged care providers. I'm just going to quickly flick through this. And here, the very last slide, as I mentioned, has all the resources. So again, people can tap in here and find out more. We've got all our patient portal, telephone assessment and treatment, which is clinical triage, which School Medical beautifully captured in our last presentation. So again, all our resources can be found within these modules as well as here, the virtual doctor appointment. This is actually the Health Navigator video for consumers, which steps them through getting prepared for a telehealth appointment. So that's our first module, as I said, of a suite of 4. We're really excited to get them out and onto the online Ministry of Health platform. So yeah, it's been a great project to work on. We're not quite there yet, but by early 2022, we should have all of the modules ready to go and live. And we'll be doing some promotion as well to just, let you all know that they're there, and then promote them through your own networks and your usual education channels and things like that. So yeah, so I just wanted to share that mahi with you today and let you know it's all coming. So as I said, it's quite timely.
Oh, thank you, Jess. Namihi, that's awesome. Yeah, just the progress in such a short time. And I know that's driven by your fast-paced way of working. So absolutely recognize that it's, really been a short space to achieve that. So as Jess says, watch this space for more. But I'd like to introduce Megan Courtney from Inspiring Communities. Now, again, a bit like our other sort of partnerships, a good thing when you come across it. Megan describes herself as a doer, a thinker, a writer, a planner, a teacher, and a learner. And I think we all connect with those, because it's about getting things done, but learning along all of those things, just really drawn to your mahi. And being a very small collaborative with only 2.5 FTE, we everything's in partnership and relationships and whakawhanaungatanga. So without further ado, I'll hand over to you, Megan, and I guess this is really a start of our journey is what I see,
Awesome. Kia ora, Amari. And yeah, tēnā koutou te whānau ki collaborative Aotearoa no Ngāti Aho ko Megan Courtney tako ingoa, ke whakatua hou I noho ana, ke Inspiring Communities aho e mahi ana. Ka mutu noa iho ngā kōrero mo tēnei wā, tēnā koutou, tēnā koutou, tēnā tātou katoa. Happy Monday, lovely to see you and thanks for having me here. I was asked to do a quick injection about community-led development, so I'm going to do a quick whip around the world in the best 15 minutes that I can. So bear with me, I'll just share screen and we'll kind of get stuck in. Cool, so a little bit about Inspiring Communities. The screen's up and showing now? Yep, cool. Inspiring Communities, as I said, a small national organisation, about 12 years old now, currently supporting a national network of around 4,500 people, agencies and communities around Aotearoa. We see ourselves as holding and supporting and championing, kind of being the backbone for New Zealand's community-led development movement, which has grown hugely in the last decade. And our 4 key roles kind of focus on learning what this thing called community-led development is, capacity building, because we need new tools in our kite to do this work, connecting up people and projects and ideas around the motto so that people can fly, and influencing, doing the bit that we can to help change those conditions for change which enable communities to lead. Recently, we've added a consultancy arm to our work called Powerdime, and that's to enable us to do more to support organisations with the how-to, because it's interesting, kind of a decade ago, the questions were all why community-led development, but now it's actually how do we do this stuff? So we look forward to working with the collective over the next year to explore the opportunities for community-led development and within the healthcare reform and locality planning opportunity that's been signalled. We'd love to work with you. So, community-led development. I thought today I'd share a couple of key frameworks that have emerged from our journey working alongside communities after the last over the last 10 years. So multiple ways of defining community, as we know, communities of interest, communities of ethnicity, online, etc., all completely valid. The lens that Inspiring Communities is intentionally focused in on is communities of place, though, because we believe that place is a really important vehicle to actually bring a whole lot of things together. So thinking about place, the whenua, here in Aotearoa, acknowledging the deep connection of tangata whenua to the land and the work and the values that are about enhancing the mana and well-being and outcomes for the people and the place that is. But community-led development, and again, thinking about place, tangata whenua, and the contributions that we can all wrap around and work in together to make the most of what we've got. It's about activating and weaving, and that means you can be coming from a local business, or you're an academic or a funder or a local resident or a GP office or a community health organisation. It's actually, we can become the sum of the parts when we actually do that weaving together, and that's what community-led development is all about. In terms of our bigger mahi, it's also about bringing together that systems change lens and community development at kind of a local level. So the who matters in this work, but more importantly, it's the how. So what does the how look like? Community-led development, it's not a model or a service that you can roll out, but from our work, we can see it's underpinned by 5 key principles that have emerged in the last wee while. And there's lots of alignments that you'll hear in what I'm talking about with Te Ao Māori and whānau ora. We can kind of bring our different lenses together to strengthen outcomes for iwi, for Māori, and for the whole of community. So the 5 principles, starting from the top there, community-led approaches acknowledge that the its will be different from different places. So what you do needs to be driven from that local place. So what happens in Kawakawa will be different from Kohi Marama and Kai Tangata. The dreams and aspirations and context of those local place set the scene. Secondly, a strengths-based approach is really important. Using what you've got to get what you want. And, you know, some people refer to this as the asset-based community development approach, but seeing everyone as having gifts and talents, and sometimes knowing as well that you have to make the extra efforts to ensure the voices and perspectives from all different parts of the community are included. It means getting creative and making sure that no one's left behind. The third one around collaboration, which is kind of a bit of a no-brainer here, and I guess in this context today, but we can see from our work that the breakthroughs happen when we bring different perspectives and different sectors together. So getting beyond the usual suspects that we kind of tend to talk to in our work, and we think about whole system possibilities. When we join up those kind of mindsets and different ways of thinking, some of the magic can really happen. Fourth, around leadership, collaborative local leadership. We need leaders out front. We need people in behind. We need people walking alongside. Our communities are full of leaders, but they often sit in silos. So there's work to be done to bring that together and invest in actually growing the leadership capacity of people, not just doing projects. So projects, process, and people all really key to community-led outcomes. The fifth one we've learned there, really important, learning by doing. And basically this acknowledges that we can't plan the work and then work the plan like we will have done in the last few decades. Complex community challenges require us to be adaptive and learn as we kind of go. It's not straight line work. It's incredibly frustrating, it's messy, it's challenging, all of those things. But if you're flexible and use your plans as a roadmap and develop the kind of the tar seal on the road as you're going, some really good stuff can happen. So while all 5 principles are really important, we can also see through our work that they might not all be there in the same equal weight all at once. But over time, and noting that some of the transformative journeys that we're talking about, we're talking kind of a 6 to 8 year period. This isn't the work of a 3-year pilot. All of those principles will come into play. So what does it look like in practice? Community-led development, or CLD, looks like all sorts of things and has different combinations of groups, people and agencies involved, and lots of people leading out in front in different places and times. It might be a hapu in Whananaki. It might be suburb-level organising that's happening in Ranwick Park and Manurewa, or in South Dunedin, where a new network's coming there together to lead some work for their suburb. Or at a sector level, focusing on kai or family violence or sport and rec, huge opportunities. So if we go a quick whip around the picture map there, an awesome pātaka kai, the growth in kind of community food pantries around the motu, this one in Pukekohe, events to bring families and communities together there in Massey, number 2, or repurposing of a bowling club in Sandringham in Auckland to be a new community hub that's doing all sorts of amazing new community connecting mahi. 4th there, bringing together migrant women and their ability to grow skills. This one here in the Mumji group in Eden Park, they're selling microgreens to local cafes, etc. Or 5, that one's Eden Terrace, where a community-led placemaking initiative has turned an ugly eyesore of a grey wall into an amazing butterfly mural. Or repair cafes, using what we've got but fixing things rather than throwing them away. Lots of opportunities. And again, you know, that community can-do spirit in the number 8 wire has stood us in good stead for decades. Some of this work isn't new, but there's an ability to expand and grow it. For an example, in Apotiki, they're now working on major transformation of their harbour. They've got some of the most amazing deep offshore marine farms, and they're reworking their whole harbour to create local jobs. A multi-million dollar project that will result in hopefully the social transformation with local jobs finally being available. Well, here, my hometown in Ngāti in the Hauraki Plains, a dairy farming area, where, over the last few years, a shortage of workers as farming's become more technically complicated and complex. The farmers sat down with the local school. They had a meeting of about 100 people and worked out how they could develop their own community training program to get local kids back into local farms with the skills that they needed. It led on to an agricultural academy that's got 150 kids in it. And they've harnessed the wider financial infrastructure of that community. They purchased a farm in 2006, so the kids had a practical place to learn. They've sold that and now own a multi-million-dollar farm milking 320 cows, with the financial results of that farm also ploughing back into the school. So lots of examples from lots of sectors about how community-led is being applied. And in the health sector, I mean, you'll have lots of examples of your own with the Southland Charity Hospital, the legacy of Blair Vining and his aspiration for the people of Southland to have access to healthcare services. This story's in its beginning, but I believe they've got about $4.5 million together now, the transformation of a tavern in South Invercargill and the hospital up and running, hopefully for 2022, with, I believe, more than 100 medical professionals also volunteering their time to support that when it opens next year. But it's not just about money, it's about all the other things around there, people providing kai and gardening and childcare, lots of things that people can do as well as support with money. Another one, I mean, pre-COVID pandemic, the pandemic that was coming was loneliness and isolation, hey? And I think it's going to rear its ugly head again next year, for sure. But the work here done in Nelson, Tasman, community hui to think about how we can counter loneliness and what we can put in place. Those groups of people putting together a plan of low-cost and doable initiatives that ranged from community transport to home visiting, promoting age kind of connect champions, and this one here, taking pets into rest homes, because actually for people that used to live in farms, this is what they've missed, and it's impacted on their identity. So another great example. And I guess coming on to the context that we've seen from the last 12 months, COVID and what's happened, extraordinary times, has also shown us what communities can do when push comes to shove. And it's quite amazing to think, how we pivoted quickly when we realised the emergency management framework didn't work in a pandemic context and required us to adapt, and all sorts of magic happened. So acknowledging the huge contribution of the health sector in the last 18 months to be part of that. Communities haven't done this on their own and government hasn't done this on their own. It's been a really collective effort. But we've got a real new reference point about what we can do when we do work together. And I think we've seen that, in multiple different layers. For example, in the Hutt Valley Common Unity Project in Kokiri Marae, they delivered 20,000 meals over about a 2.5-month period in lockdown last year. But they've taken that new learning and relationships, and they're moving from collective emergency food management into food resilience and kind of food security. So an ability to keep building off our work. The iwi checkpoints, an amazing initiative that has supported, COVID coming into rural and vulnerable rural communities, and the self-organising that Hapu and iwi did to keep their people safe and needs met. And the amazing neighbourhood responses more broadly, people delivering scripts of, pharmacy scripts that were needed, from fencing supplies as well to food. We just got on and do it. So Inspiring Communities did a really interesting look at how the magic happened last year, a report called Shaping the Future, and there's a little link to it in that. And so thinking about what we know can work and how we do more of it, I think is part of the opportunity. So a different BAU is required, and space for both content, in this case, the health sector workforce, and context experts, local people and communities to work together to make things really happen. And just finally, I guess my last slide is an opportunity and a challenge. And it's this one, noting that we're hearing lots about community-led development. And we're really passionate to make sure that the words that we use are more than just words and actually change practice, because it does require a different business as usual. It is about better engagement, community engagement and planning, so that priorities reflect local needs. And it is about more community voice and shaping and improving the delivery of healthcare services. But it's also, and this is the edge, I think, how can communities be more active partner in health and wellbeing outcomes? And this is, I think, the ledge that we could jump on together to explore. So, yeah, thank you for your time today. Happy to take any questions, and yeah, look forward to working with you and talking more in 2022.
Thank you, Megan, Ngāmihi. So yeah, floor's open for questions. Yes, I think we're on that ledge together to just, work with our communities. The challenge was put to us earlier as well, is how do we engage real grassroots? And I think, the work that you've done in other sectors like local government, that can really be learned from and then brought into health. And certainly, there's been pockets of amazing engagement, but I think like everything, it's a journey. So yeah, that was inspiring to see all of those community initiatives and the impact. So we'll of course obviously share the slides in the recording. Jude McDonald's saying she loves that last slide. Who wants change? Who wants change? Yeah, so it really resonated. But any questions? Any hands up right now? I know it's the after lunch slot, but I mean, from our collaborative point of view, really, thinking about the health reforms and localities, what would be the one piece of advice you would give us to get us on our journey of supporting grassroots?
I think for me, part of the key is thinking beyond engagement. I think if we think good engagement as it's a first and it's a really important step, but actually there's another step we all need to take, because actually local people can be change agents as well. We've seen it a lot in the UK where, through austerity, it's almost been forced on local communities to stand up and get more involved. But actually, if we can do that without that driver here in the same way, there's huge capacity in communities that can be unleashed if we actually engage in the right way and actually follow through. Heaps of opportunity, I think. Yeah. Let's not be scared.
Yes, that's right. Be brave and be vulnerable about it. Vulnerable. And Andrew Miller, who was on today, always says, bring it back to what matters to whānau. So if we really truly get underneath that, and that's certainly the collective impact approach that we've heard earlier in the day, in terms of initiatives like Aura Connect, we're working on that approach and tailoring it to Aotearoa. So we will share that far and wide in terms of resources, just to get people thinking, because those community aspirations really translate to what matters to whānau, and then what are those activities that you're going to do together, and it's with, I guess I'm hearing a lot of it's the with and not for. So it is, we, just for everyone else's knowledge, we in continued discussions with Inspiring Communities, and they offer quite specific tailored training in this area, and just sharing the learnings further, because to ask Megan to come and do justice to this in 15 minutes, it's almost like whets the appetite, and we all kind of want to go, wow, let's go deep. So we are looking to bring something to you in the new year around this, and Kanita, who is with our collaborative now, is working in that space, and there'll be lots more insights as we move forward into those health reforms. But without further ado, then we'll move on to the next presenter, but just know that you can email in any of the questions.
I think Helen's got her hand up.
Cool.
I was just going to offer an observation. Megan's work's excellent. It's always good to hear you, Megan. And I think my observations learning within the Equally Well Collaborative are kind of learning to work and think differently, feeling a little bit uncomfortable at times, clashing up against the status quo that tends to push back in the system but that's a good thing. So if you're feeling a little bit of tension and all those things, then that's really good. So I just wanted to, one of the big things I'm thinking a lot about is how collaborative leadership is different from a kind of standard governance, bureaucratic leadership, so those sorts of things, how you encourage distributed leadership. They're all different techniques, aren't they? And there's some people like me who really want to delve into the how, and there's other people that just want some people to get on with the how, and they just want to get on with the mahi. So it's also respecting that, Megan, isn't it?
Absolutely. There's no one way for any of this stuff. And I'm really mindful of that. If there were simple solutions that I could just give you to say go, it would be great, but it doesn't exist. Even in international collaborative governance stuff, what people are saying, part of this is thinking about the learning and applying it to context. And that's the work that we all have to do as we step into it. Thinking about the work we need to do before we get in the room, and when we get in the room, what's the next bit of work? So yeah, agree with you, Helen.
Awesome. Thank you. I'm sorry I missed that hand up. I think there's cool. I'll hand over to you, Jess, in terms of our next group. And thank you so much, Megan.
Ka kite.
Ngā mihi, Megan, ka kite. Okay, so I have the privilege of introducing the next presenters. So kia ora to Ranoff Medical Centre, who are joining us from Rotorua today. Carly and I started chatting about a year ago around healthcare home and bringing a practice who had already come a very long way implementing some of the healthcare home aspects, and without any funding, just knowing it was the right thing to do for their whānau. So yeah, I was really inspired by their journey, and can't wait to hear about their presentation today called Tito o Te Tangata. So I'll hand it over to you. Kia ora.
Kia ora. Lovely. Well, I'll just share our screen, so bear with us. We just do this. Right. Why are we not doing that? Sorry, guys. No, that's not what we want. Just do that again. Just find which one we are. Oh, there we are. Perfect. Lovely. Okay. Thank you. That's it. That's all great. Okay. We start. Perfect. Everyone can see our screen.
Yes. Yep.
Okay. Lovely. Awesome.
Can you see the side bits as well, or just the slide?
We can see the side bits. It's up to you. Okay. I mean, we don't mind seeing the side bits, but
Okay, make it bigger.
I don't know.
It's to do with the fact that you've got two screens.
Yeah.
Yes.
Yeah. Two screens. That's right.
Yeah, and you're going to change it to that other screen somehow.
Oh, do we? Okay.
Yeah.
Bear with us. Sorry, we do it this. I don't even know how we do that. Okay, I don't know how we would just have to leave it like that. Okay, that's fine. We'll just have to leave it how it is. Yep. Okay. Okay, do you want to start?
Okay. Ai kia ora tātou. Tēnā koutou katoa, anei mātou ngā kaimahi o te whare hauora o Ranolph. Kei rotorua nei, e mihi kauana ki a koutou, nau mai, haere mai.
Ooh. Sorry, we're just getting some funny writing down the bottom. How do we stop that? Can you see that writing at the bottom?
Yes, we can. Kirsten, do you want to share that? You've got the slides. Do you want to share them?
Yep, I can share, then you can just tell me to change when you're ready.
Yeah, I'm not sure why that's coming up. It's weird. Yeah.
So if you stop sharing, Kelly.
Okay.
You've got you must have dictaphone on or something
Okay,
like that.
sorry.
Hang on.
It's a good start. Okay.
Keeping it real.
Got dictaphone.
Oh,
Yeah.
so we're watching that one. Okay,
No, we
okay.
want the dictaphone.
No, we don't want it. Are you still seeing our screen?
That's all right. Kirsten's going to share the slides.
Yeah,
We can just see your beautiful faces. So.
Oh,
Okay.
okay.
Hang on, I'm just opening it.
Oh my God.
Apologies.
Look, it wouldn't be a virtual health summit without some IT issues.
Yeah. Okay,
That's
great.
Hang on. There we go.
Yes.
Okay.
Kai, kia ora.
Oh, thank you. Kia ora. Right.
I'll start again, eh? I'll start mihi again. Tēnā koutou katoa. Anei mātou ngā kaimahi o te whare hauara o Ranolph, kei rotorua nei, e mihi kauana ki a koutou, nau mai, haere mai. Ko te whurua ine taku ingoa ki te taha o tōku whaia, he uri ia hau nā te aroa rāua ko tainui waka. Ki te taha o tōku pāpā, he uri huki a hau nā te waka o Takitumu, o te au o Tonga, o ngā puariki mai te kuki airani, he nehi pau tangata a hau I te whare hauara o Ranolph Medical Centre. Warm geothermal greetings, everyone, and welcome. It is our pleasure to be with you today. We are kaumahi or staff from the Ranolph Medical Centre in Rotorua. My name is Jeff Ruaine. I am descended from Te Aroa and Tainui Waka on my mum's side, and on my dad's side I come from Rarotonga, Aitutaki and Mangaia Islands of the Cook Islands. I am a tangata ora nurse with Ranolph Medical Centre here in Rotorua. Nō reira, tēnā koutou katoa, kia ora ana tātou katoa.
Ko Kaile Tukuingwa, no tauranga ahau, he matanga te puhi Tokomahi Ranolph Medical Centre. So kia ora, my name's Kylie Picken. I'm the nurse team leader here at Ranolph Medical Centre and I'm a nurse practitioner as well.
Tēnā tātou, ko wai tēnei mua I a koutou I tēnei ahiahi a tāhua, he uri tēnei no Ngāti Kahumunu, no nai tūhoi me te aroa hoki, ko Sonia Hirani Lewis taku ingoa, he nehi a hau, kei te whare hauora o Ranolph Medical Centre I Rotorua. Ngā mihi nui ki a koutou katoa.
Next slide, thanks Kirsten. So thank you for the invitation today to share our story. We're a little bit different. We're a grassroots practice that is wanting to share our story on some equity work that we're doing in the space for our Māori patients. We've got a little plan for our talk today. So I'd like to introduce our medical centre, so Ranolph Medical Centre. Just talk to you about our equity journey so far, some of the foundation work that we've put into developing a tangata order unit, which is a Māori-led service within the practice, and just some stories from patients about Te Tau o Te Tangata, which for us is the year of the patient. The next slide, thanks. Perfect. Kia ora. So we are a mainstream general practice based here in Rotorua. We've been around for 30 years, and we've got a dedicated kaupapa unit, which was established this year called the Tangata Order Unit. We've got roughly 12,000 patients enrolled, which is about 16% of the population of Rotorua. Of those patients, we've got 49% are high need, and Rotorua itself has a high population of deprived patients. We've got about 56% New Zealand European, about 30% Māori, 1% Pacifica, and 16% of others. Within our practice, we've got a clinical staff of 10 GPs, two nurse practitioners, 2 designated prescribers, 7 practice nurses, 2 healthcare assistants, 1 health improvement practitioner, and 8 admin staff. Within our wider MDT team, we've got some health psychologists, a social worker, and a clinical pharmacist, and that's all part of the PHO. And we also utilise the Te Aroa Whānau Ora for our health coaches. So we're part of RAFS as our PHO and part of Lakes DHB, and we have become a healthcare home practice as of this year. So as Jess alluded to, we've done this ourselves and put in the mahi for that ourselves. Thank you. So next slide. So our equity journey is still a journey. We've been aiming for equity of health outcomes for a number of years, and it's always been a priority of ours. So we regularly report on more easily measurable outcomes such as smears, immunisations, mammograms, diabetes check, and we do this by ethnicity, by quintile, and by provider. And we compare these numbers by local and national numbers and over time. Sir Mason Jury has always said that suggested that we should be recording this progress over time, and in the manner of the graphs shown on the slide. And that's demonstrating the achievement of equity of income and narrowing the gap. The slides that we've got up demonstrate the work that we did in significant improvement of outcomes for our Māori women and our Pacific Island women for smears between 2010 and 2018. And unfortunately, after this, we changed PMS systems, and we've really had a struggle to try and get the data back again. So we did a really good job at narrowing the gap, but at the moment we're working on the analytics to see where we're back up to again, and things have changed. COVID this year has gotten in the way of the dynamics of how we see our face-to-face consults, so it's about trying to figure out how we get back on track for that as well. And until this year too, we haven't really reported on equity in terms of relation to patients' health experience. So we'll talk about that in a couple of slides. The next slide, thanks. So we've done some foundation work to get to the Tangata Order unit and the Te Tau o Te Tangata. So some work we've done is on whanaungatanga and relationships. So that's with community, PHOs, the District Health Board, Ministry of Health and stakeholders, and also fundamentally with patient and whānau feedback and using our kamatua. We've got relationships with the Healthcare Home Collaborative in terms of some guidance as well. And Sir Mason Jury also said good leaders join networks so that their followers can have greater opportunities. Bad leaders develop walls so that outsiders cannot get in and insiders cannot get out. So we've also done a lot of work on Rina Tiratanga, on governance and leadership. We have got a board of directors, which has got accountability for the decisions made. And we've got a clear direction of equity, and inequity is not okay. We've worked on strategy and culture within the practice, staff engagements and decisions made, and the practice culture that will enhance services and delivery for Māori. Our strategic planning this year, we included the whole practice. It was on a Sunday, everyone came, which was really awesome. And our planning, we called the session Te Tau o Te Tangata. It was the year of the patient. We've worked on things like practice changes, implementing new roles, extended roles of the nurse practitioner, designated prescriber, the PCA, and the health improvement practitioner, just to help increase equity for appointments. We've done a lot of work on knowledge and understanding and data intelligence, the mā kodanga. Sir Mason Jury, again, he talked about the closing of the equity gap and rates between Māori and non-Māori, and our decisions are made on clinical business intelligence. The work did halt when we did change PMS systems, but we're sort of back on track with that again too. And the important thing is understanding the context of our Māori health issues for our patients here in Rotorua. We've done some work on collaboration, so engagement with whānau and providers, communities for consumer co-design, including local iwi, and the healthcare home journey highlighted the importance of doing this for us. A couple of years ago, we did a joint project with the Ministry of Health and the Lakes DHB on our transitional care pilot. We had a nurse that was employed, and her job was to help transition patients out of hospital and try and decrease the risk of there being re-hospitalisation. From the pilot that was over about 18 months, we did have improved rates of readmission, and we learned a lot the individual experience of the patients, about the illness experience, what matters to them rather than what matters to us. And in terms of care planning, and we learned a lot of what equity is. We had a lot of learning on barriers of access to care. It opened our minds to different solutions, improved self-management, improved service efficiencies and equity. And the learning about the patient care was when and where and what the whānau actually needed. It wasn't really within the constraints of how we were doing things in terms of appointments here. It might have been home, telehealth, hospital, ward, outpatient. Its ability to be flexible. And under our governance at the moment, we had the permission to do things differently. So that's where we stepped into with the Tangata Ora space. So we developed this unit in February this year, and this is before the health reforms were announced. For us, it was about rethinking the delivery of Māori health within a mainstream general practice. And this year, our key strategic goal was Te Tau o Te Tangata, so the year of the patient. Next slide.
Hutia te rito te harakeke, kei hea te kōmako e kō, ki mai kia hau, he ha te mea nui o te ao, māku e ki atu, he tangata, he tangata, he tangata. If the heart of the harakeke was removed, where would the bellbirds sing? If I was asked what is the most important thing in this world, I would be compelled to reply, it is the people, it is the people, it is the people. The whakatauki by Te Aupauri Wahine Rangatira Meri Ngaroto in the early 19th century speaks about people being the most important thing in this world. We liken this to include how we treat and look after each other also. As Kylie has mentioned, we knew that we had to create a way to close the equity gap and recognise the need for better engagement with our patients. So the idea of a unit with a focus on Māori and Pacifica health within our mainstream clinic was born, Tangata Ora. Tangata in this instance meaning person or man, and Ora meaning health or life. Tangata Ora provides an understanding of how better to engage with Māori and Pacifica patients. It is for Māori and Pacifica patients needing extra support, and it is run and led by Māori and Pacifica health clinicians. We recruited another nurse, a Nihi Pro Tangata, and started our mahi in Feb this year with one main goal in mind, equal life expectancy. How? Through relationship building, trust and respect. So a typical day for our Tangata Ora unit will start with a quick huddle to discuss any patients needing our support that day, and also to follow up on any patients we have seen the day before. Our hospital list is checked daily, and relevant patients are contacted via either cell phone or face-to-face, ensuring that they know we are here to support by way of medication education, as well as educating them on why and what their outpatient appointments are actually for, by providing transport and breaking down any other barriers that may get in the way of quality health care. Patients are referred to us internally, but not all Māori and Pacifica patients come through Tangata Ora, just those needing extra support at that time. We are here to empower our patients. We are not here as enablers. Next slide, please. The implementation of Tangata Ora has brought with it several positive workplace changes. Our entire staff at Renouf Medical Centre are involved and committed to monthly Te Reo Māori lessons. Te Wiki o Te Reo Māori is just one kaupapa or wero challenge that we have taken on and support. Signage throughout our clinic is now bilingual in both the English language as well as Te Reo Māori. The Renouf Medical website will soon be offered in Te Reo Māori also. So these are just a few examples of how our staff and clinic are showing a commitment to our Māori patients and their needs through creating a more inclusive environment. Oh, could you go back, please? We have our own Tangata Ora social media in progress, and we are involved in community COVID-19 work and also offer patient co-design health sessions. Thank you. Next one, please. As mentioned, Tangata Ora has a strong focus and involvement with COVID-19 mahi, both at Renouf Medical Centre and within the community. A few examples of community collaborations we have recently been involved with are the Te Aroha COVID vaccine drive-through, the Te Aroha COVID response team, local gang-initiated vaccine drives as vaccinators, Murupara vaccination drive due to low vaccination rates, local kohanga reo education sessions around COVID and vaccines, as well as vaccine promotional work both locally and nationally.
Thank you. Next slide. Yes, we've done a bit of work on some COVID mahi within the Tangata Order unit, and that may be providing transport to appointments, phoning our unvaccinated and partially vaccinated patients just to have a kōrero about that. And that includes some of our GPs doing that. And a whānau approach as well, so vaccinating the whānau together. And we've really had a focus on our Māori and our Pacific Island patients because as a DHB, we actually have quite low vaccination rates. We have found the data quite hard to pull, and the onboarding itself was quite difficult. We're one of only 2 practices here that have actually onboarded in Rotorua. And we only managed to onboard, we were the first ones on the week of Super Saturday, so it was a real learning curve on that day. Most of us hadn't actually done any yet. But this slide shows just over a couple of weeks what difference that mahi made. So we went from full vaccinated rates for our Māori patients in 29 to 37%, and our partially vaccinated patients went from 15% to 20%, just with a little bit more effort. And the COVID work is new and every day is changing. I mean, as of last week, we're now managing our positive cases in the community, so that's new for us. So there's a lot of work for the Tangata Order space within that. So next slide. Next slide, thanks. Yeah, great.
Because Tangata Order has been given permission to do things differently, a collective impact is also an important part of our Tangata Order strategy. We have built a wide network with community organisations and work in partnership with them to ensure wraparound support is available for patients in need. We have a good relationship with these organisations that we endeavour to maintain going forward. Just to name a few, we have Te Aroha Whānau Order, where we work closely with their health coaches, Te Aroha COVID Response, that's a drive-through vaccination and also the future COVID planning, Smear Your Mea, which creates equality for women's cervical screening, and also our own Reno pharmacy through patient education sessions.
Next slide, thanks.
And that leads us into patient co-design. So what does patient co-design look like to us? So we teamed up with our next door neighbours, Reno Pharmacy, to deliver an education workshop on gout. We identified Māori patients living with gout and those newly diagnosed. The design of the workshop was developed by patient feedback on what they wanted to learn. What is gout? How do you get it? How do you treat it? How is it prevented? These were common questions that guided the workshop theme. We know that our personal story is one of the best education tools when working with Māori. I shared my own experiences of growing up with gout within my whānau. My koro, my mum, my dad, they all lived with gout. So my personal self shared my own experience of living with gout and the importance of treatment as prevention alongside healthier nutrition. And my professional self discussed gout etiology. Our lead pharmacist next door at Ranoff Pharmacy provided her professional expertise and knowledge with gout. She spoke in depth about gout treatment and medication pathways, opening the doors for partai or questions and for kōrero discussion. As Māori, we work best face-to-face, kanohi ki te kanohi. This is an essential strategy as it promotes open dialogue and allows us to utilize active listening, engage non-verbal communication, and because, well, that's how we roll. Feedback was gathered by kōrero afterwards, asking what worked well and what could have been improved. Next slide, please. So one of our success stories within our program, we've got a lovely patient story here. A Māori male, 47 years old, newly diagnosed with type 2 diabetes mellitus, not seen a GP in 20 years. He utilised Te Whare Tapawhā on his journey of wellness. So Te Taha Hene Ngaro, mental wellness, he got educated. He learned what is diabetes, how does it work, how is it treated, and he identified key goals. And the biggest goal for him was to be here and to be healthy for his 50th birthday, which is just around the corner. Te taha tinana, physical wellness. So it was about kai, nutrition. He changed his diet and learned what are the best foods to eat and why. With exercise, he identified what he likes doing first and foremost, because we're not likely to follow an exercise regimen if we're not into it. So he identified that walking outdoors, especially in the bush, enabled him to connect with Papa Tuanuku, Mother Nature, and in turn nurtured his wairua. He also nurtured his wairua, his taha wairua, through karakia and through meditation. Te taha whānau, or the family or social wellness, he enlisted the tautoko or support of his partner, friends and family. Staying socially connected gave him strength and motivation, plus helped him to stay on track. He also learned from others within his family how they managed living with diabetes. So within 5 months, his HbA1c, which is the diagnostic test for clinically diagnosing diabetes, went from 95 down to 67, and he lost 10 kilos along the way. So I'm envious about that, but also very happy. I mean, who doesn't want to lose 10 kilos, right? Right. Thank you. Next slide.
Another example of a successful patient story is this one of Manu, a 62-year-old female of Māori and Indian descent. May I just mention that Manu has given us permission to use her image and her story in today's presentation. Kia ora, Manu. Manu transferred from a different clinic to Ranoff Medical Centre in Feb this year, where Tangata Ora soon took over her care. She presented to us with cellulitis in her lower left leg and verbalised that she had had enough of the health system, as she felt she was not being cared for, and as she was not being cared for appropriately and felt unheard. Tangata Ora applied the fundamentals of Tā Mason Jury's Te Whare Tapawhā, as mentioned earlier by both Kylie and Jeff, by providing care and understanding for both her and her entire whānau. Taha tinana, taha wairua, taha hinengaro, and taha whānau are all entwined, and to offer quality healthcare for our patients, all of these aspects need to be addressed. We help to break down barriers by providing clinical education around medication, accompanying her to hospital visits as support, and providing quality care in a non-judgmental environment. Her faith in healthcare has now been restored, and Manu is now much healthier and happier, and so are her whānau.
Kia ora, Manu.
Kia ora. Next one, please.
Next slide. Yeah, so that's really coming to the end of what we've talked about today. So where to from here? For us, we continue to work on the analytics part of it, and also the fundamentals, what we talked about before, the patient co-design, listening to the patients and what they want, and their whānau, what they want and what they need from us, not what we want from them. The collective impacts, to continue to work with our communities, the local iwi, and we'll see what happens in the health reform space as well. But for us, Te Tau o Te Tangata will continue through to next year. So next year will also be the year of the patient. Be an interesting time, like Professor Rod Jackson said, it's going to be a messy year next year, but we'll see how that goes. But kia ora and thank you.
Kia ora.
Kia ora.
On ngā mihi, Ranoff Medical, that was awesome. Whakahihere, that was completely inspiring, and you can see your commitment to your kaupapa shining through. So we're just going to pass it over. Does anyone have any questions? You want to raise your hand?
One in chat, Jess.
Is that it about the awards, Gary? Claudia, do you want to ask that in person? Oh, you're on mute.
Kia ora te whānau. Amazing mahi. Thank you so much. It's just amazing to watch. I'm really curious though, if you've got internal referrals being done, how do you avoid the whānau who are being offered this extra support experiencing any kind of whakama or singling out in that process? And the other part of that question is, if whānau circumstances suddenly change, maybe slightly outside of this being in the clinic, how are they made aware of that extra support being available around their health journey if they're not being directly referred at the time?
Okay, kia ora kororia. He pātai pai, tira. So to answer the first part of your pātai, how do we get our referrals without making whānau whakamā? Very carefully. So although we are the Tangata Ora unit, kei roto I tēnei whare hauora, inside this whare hauora, all our staff are very well aware of how to treat all our patients, whether they are part of the Tangata Ora unit or not. And so that goes with, they may come to us and say, I've got somebody that I think may be appropriate for your tautoko with the Tangata Ora unit, and then they'll leave it up to us, and then that's when we have our haru and we go, all right, patient X, maybe we contact them and we just look right into all their details and then work it out from there. And then it's us who reach out to our patients the way we know how, the best way we know how. And by all means, patients can decline us, but the majority of them don't. They will say, okay, because they realize that we come to them with the understanding that we understand them and they understand us. Did that answer that part of your pātai?
Awesome, perfect,
Thank you. Your second pātai, how do we get tautoko from outside? That's our collaborations that we've made with all these organisations. Was that your second part of your pātai?
I guess more, so I know within my own whānau, a lot of them are week to week kind of living. And so they might come into the clinic and have a kind of a plan around what's going to happen in the next 3 weeks, 6 weeks, whatever. Yeah. And then mum has been told that there's no work for the next 2 weeks. Suddenly the financial situation's changed, everything's changed, and that might enable transport with petrol prices or anything like that. How are they aware that there's this extra support available in the clinic if they haven't been in the clinic when those circumstances have changed, that might be able to support their journey moving forward and not derail it? Like I see a lot of derailment up here, and because people are traveling so far for appointments, etc. Sorry, I'm in Te Tai Tokoro. So you know, if there's a derailment of a health appointment, it can set a health journey back by months. And so what I'm interested in is how you make the awareness of that extra support available inside your practice that would support whānau to perhaps reach out to you, as opposed to, you know, because the circumstances might have changed in the meantime. Does that make sense?
Yeah, sure. Thank you. Thank you. So we've got a few things. We've got a recall system, which is fantastic, where if any of our patients are slipping under the radar in terms of we suddenly aren't hearing from them or they're not turning up to their appointments and things like that, then if they are Māori and Pacifica descent, they will still get referred to us internally. So we check our recalls every day. So that's one way. If they're overdue for smears or childhood immunisations and all that kind of stuff, and we think actually this whānau are usually here all the time, suddenly they'll come up either way if they're overdue through our recall system. And again, Tangata Ora is alerted, and then we will contact the whānau and just offer our support in a non-judgmental way, in an understanding way. If they need transport, we will pick them up, we will drop them off, and we'll do everything we can to work collaboratively with outside organisations to make sure they're getting quality care as well as we can.
Wicked. Oh, ngā mihi nui, kia ora. The mahi is amazing. Thank you so much for sharing.
Oh, ngā mihi nui ki a koe hoki.
Kia ora, tai toke rau.
Yeah, kia ora. And I think that's going to be the same challenges. I mean, you're already working kind of in that locality space, and that's some of the challenges that we're just going to have to work through as a sector, and do it in a gentle and kind manner. So yeah, kia ora. Right, I think that's it. again, ngā mihi to you guys for, you know, we're running a little bit late, so thank you for your time commitment. I know the clinic is busy and yeah, your time commitments. So kia ora, thank you. And we're already getting so many comments. People, yeah, love to see your presentation. So yeah, love to share your work even further. So kia ora.
Kia ora, kia ora tātou. Thank you.
We've just got 2 minutes to close, and Andrea wants to say a couple of words. So if I can just keep you for 2 more minutes, I just want to say thank you for all being part of this Whirlwind Summit. Most of you have obviously dropped in and out of the day or been here all day. So if you have, you're going to be feeling pretty worn out. I am, but it's been worth it because the presentations have been outstanding. As I say, we'll keep this short, but I just wanted to share some highlights. And, you know, hopefully we've lived up to the theme of leveraging the community strengths, drivers for change, and the importance of digital health. So we've covered a lot, some of the gold nuggets. Eddie set the scene this morning with Tatariti o Waitangi and equity front and centre. And this is the core of our mahi for sure. And, you know, across all of our presentations, we've seen that come through very strongly, along with whakawhanaungatanga. Andrew laid us the challenge to truly connect with what matters to whānau, being open and listening. Our lived experience team, again, you know, keeping us grounded and working with our sector partners so that we can actually do better, you know, and I love the comment around it is about being part of the network, because that's the only reason we can do what we do. Or to connect, a real live collective impact initiative that it will strongly inform the locality's mahi that the government's, you know, taken forward. And that's great for that sharing to take place. And Jude, in terms of being that bold and strong leader, you know, the strength in our communities, ensuring that it's iwi-led and community driven, again, upholding that in terms of equity. The focus on the healthcare home, we could have had a whole day on just on healthcare home, we realise that, but there's so many competing objectives to try and you know, get as much out there, but you know, and some of them will be teasers to go deeper, but that invaluable sharing, and I know the mahi that our leads do, but what Jess leads within our collaborative is just outstanding. I take my hat off to you all. And then the digital health, again, you know, Jess, in such a short space of time, getting that module up, and then more to come in January, really responding to what the sector needs, and being agile around that. You know, it's good to be small sometimes because you can be agile, but other times it's, you know, it can be a drawback. And, you know, our newest partner in terms of inspiring communities, their mahi and community-led development will see us, you know, go from strength to strength in terms of supporting the health reforms. Our challenges as a network, how do we get those that hold the power, so to speak, getting them to listen and help them shift that power base. But last by no means least, obviously runoff, the year of the patient, again, keeping it real and keeping that equity lens. It really is just, you know, inspiring to see and for us to learn from. Our small little collaborative, you know, works on that, building trust and relationships, and that the network has a say, but we are guided by those we serve. We listen and we kind of go, well, what is needed? I just want to take my hat off again to my team, and I want you to give to make sure, I mean, you know, obviously Jess has been presenting, Kirsten around the logistics, but Kanita is there. And I just don't know whether you can wave if you are still on. And Jo Henson is also part of our team, but I know she has had other things on this latter part of the day, but just great to be part of this team and working with you all. I'm going to hand over to, hopefully that was less than 2 minutes, but Andrew, I know you've got some wisdom for us. So that was, you know, fast.
Amaja just dropped me in it. She said, oh, Chiquita was going to close, but can you do it? And that was about like 2 minutes ago.
That's why I love you, Andrew.
You're right, Ranulph. That's awesome what you're up to. Cheers. Hey, I guess, you know, in summary, I guess what I've heard today is that we need to start with whānau. You know, these stories and ask them what matters. We need to start caring. Let's care for whānau. Stop delivering them services. We need to actually start empowering wellbeing. This needs to be strength-based, you know, power up the power and capacity of our communities. And I think we need to humbly accept that the status quo isn't working and we're responsible for why it's not working. Our mahi needs to be equity focused, needs to be transparent, it needs to be collaborative, and it needs to use a collective impact approach. We've had some amazing examples today, people actually practices doing the mahi, which it was really exciting and inspiring to me. You heard me say before that culture eats strategy. I mean, we start with ourselves. We need to walk the walk. We need to embody well-being and how we deal with each other and those we care for. We can do that right now. It's not what we do, it's how we do things. And we need to make our mahi to work for those that need it most, not those with the most influence, the loudest voices, those that have actually, to date, shown they actually can't get this right. So I think we can be champions for some of the principles you talked about today. And I don't think we need to make this harder than it needs to be. I can't see why we shouldn't be optimistic and courageous in our korero and mahi from here on in. And it's been lovely to spend a day with such a positive group of people and the positive vibe. Thank you so much, all of you. And I think you've made me happier, that's for sure. So cheers.
Thank you, Andrew. We'll just close with karakia, and Kirsten will lead us in that. Is that okay, Kirsten?
Sure. Hang on. Closing karakia. Ke hora tamarino, ke whakapapa punamu tumoana, ke tere te karohe ruhi, e mua e te hura wahi. Thank you, everybody. Great day.
Ka kite.
Hakite matewa. Thank you very much, everyone. Good to meet
Thank
you.
you.
Thank you. Kia ora.
Matua.